My name is Marisabel, Gouverneur. Can you hear me?
Yes, Marisabel, we can hear you. Thank you very much. We appreciate your making the time. And you've got 10 minutes to make some comments and have some dialogue with us if you like.
Okay, so I have to start off, unfortunately, by telling you that I have done heroics to be able to speak to you today. I have called your number several times. They must be tired of me. So there must be some way that this has to be a bit easier. I'm also more than 3/4 of a century old, so I'm not like computer literate in any significant way. So you guys are doing great work, but unfortunately, you must do more. So I have actually submitted a written statement, but I'm going to read to you this. I'm going to cut it down because I was afraid you would not listen to me for more than 3 or 4 minutes. So I've cut it down significantly, and I will read it to you. Should I start?
Please.
Who has the clock? Be fair to me now. Okay.
I promise.
My name is My name is Marisabel, Gouverneur, and I'm a retired clinician. Would that I could influence you to serve the citizens of Oregon and provide them with what is within your power, the evidence that healthcare, as we now know it, is experiencing difficult and needing significant, if not monumental, change. We are hardwired to continue to do what we have always done. We are afraid of change. As a legal immigrant who arrived at the age of 3, I could see the United States from the inside and the outside. Lucky me. The U.S. was a model in most fields. As we know, some admiration was deserved and some was not. The U.S. was less than perfect, but perfect is what we strive for, not what we expect to achieve. The United States has historically been caught up in issues of racism, inequalities, homophobia, fear of the others, immigrants, migrants, imperfect but striving. I purposely have lived in Oregon because I believe that change has been and is possible in Oregon. We strive, we often succeed, and we must again. As a graduate student at Emory University, I became aware of the health conditions of blacks in Georgia. I was appalled. I worked in public health in Oregon and saw the dire needs of many. The healthcare system as we know it is broken, and by definition was so from the start. We must be willing to do what has never been done before in ways that are new and far-reaching. This pandemic, if nothing else, has taught us that if a population in our society is unwell and suffering, so are we all. My best friend Marguerite went to hear her opera singer daughter perform in Vienna some years ago. Happy days. During Marguerite's visit, she suffered a heart attack. She was rushed to the hospital. The care was excellent. We wondered if they were doing that because she was a foreigner. No, it was routine care. When she returned home, her primary care provider was impressed by the quality of care she received. Marguerite, however, was overwhelmed by the fact that the care was routine and cost-free. She paid nothing for the care she received. The care was considered premium quality, and it was free. Life went on without trauma. My cousin Maritza went to the UK to visit her daughter in graduate school to see the country. Happy days. Maritza took seriously ill, was rushed to the hospital. They saved her life with surgery and treatment. Unaccustomed to the UK health care, we were stunned that all had been done at no cost to the patient or her health insurance. Life went on without trauma. My brother Simon, a well-known painter in what was known as the Washington School, became ill some years ago. Due to his employment as a professor, he had health insurance. He was treated and was well on the road to recovery. I was with him for days to help him. A bill for greater than $50,000 arrived. I spoke to my brother, assured him that we could somehow figure this out. At that time, $50,000 was almost the price of a modest home. My brother insisted that he would never recover financially, not at the age of 57. I stayed by his side. My brother was a well-known artist. He was gifted, talented, was a hard worker, was an inspiration to his students. He was an outstanding citizen at every level. Overwhelmed by the cost of saving his life and his inability to recover financially, my brother took his own life. Life has never ceased to be a trauma for all who knew him. What you are being asked to do as a task force is to see the future with the global evidence before you. If government is tasked to care for those who need, it is tasked to care for all of us. I'm asking you to see in new ways, to care at a granular level for a society whose response to healthcare needs has proven inadequate and biased when keeping to the ways of thinking in the past. The idea of fixing it later has never worked. What is needed is a response considering issues that are historically ignored and hidden in the past. I thank you all for your kind attention to my concerns.
Marisabel, thank you for a couple of things. Number one, thank you for making real and very personal to us the tragedy of our healthcare system.